Welcome to this module on health policy. My name is Göran Tomson. It's my pleasure to present this to you today. I'm a professor of international health systems research here at Karolinska Institutet. I'm also the leader of the Health Systems and Policy Research Group. The structure of my presentation is as follows. I'll start with the policy definition. Welcome, Mairi. Continue with the policy models, evidence-based policy, example of Millennium Development Goals, very important policies of global health of today, and finally explore the concept localization. Last year, in dark December, I had the privilege of representing Karolinska Institutet when the Director General of WHO, Dr. Margaret Chan, visited us during a couple of hours to learn about research. Her vision is to ensure or work towards universal health coverage. That is, the goal of universal health coverage is to ensure that all people obtain the health services they need, prevention, promotion, treatment, rehabilitation, and palliation, without risk of financial ruin or impoverishment now and in the future. That's an important policy. Now, health policy can be understood as courses of action and inaction that affect the sets of institutions, organizations, services, and funding arrangements of the health system. Don't worry if you don't remember definitions. They are quite often difficult to remember. Let me now market this excellent book called Making Health Policy. If you read chapters of this, reflect on these chapters, it will become evident what health policy is. There are different models. As with life, you can look at things from different angles. Some use the rationalist model. I'm not going to explore what rationality is. Some would say that policies are more incrementalist. That means policymakers have to muddle through decisions, not least dependent on political systems and political realities. Then the grand old lady, Jill Walt, the Professor Emeritus from London School of Hygiene and Tropical Medicine, and a very pioneering professor in health policy. She has her so-called stages model: problem identification, policy formulation, policy implementation, and policy evaluation. This triangle, and now I come to policy analysis, was quite groundbreaking when it was presented by Lucy and her, let's call it former student, Lucy Gilson. And Lucy Gilson today is probably the leading health policy analyst, and we at Karolinska Institutet are very happy to work with her. We have collaborative projects with her. They talked about the content of the policy, the context of the policy, the processes involved in the policy, and what has often by others been forgotten, the actors, those that really make things happen, be it individuals, groups, or organizations. Let's look at these four concepts. And on this PowerPoint, we'll start with the context, the systemic factors, political. Let's stay with political. Reality for policies would be very different if you're in a, let's say, liberal democratic society, a fundamentalist society, Islamic society, Southeast Asian society. It's obvious for each and every one of us to understand that this matters. Now, other things like war, major epidemics like the HIV/AIDS epidemic also matters for policy. Content. So I'll take two examples of content of policies. One would come from one of the most threatening aspects or threats to global public health, namely tobacco. So what happened when we got our house in order in our part of the world, that is Europe, and also United States, then companies immediately starting very actively and quite aggressively marketing tobacco in countries like Vietnam and China. Drug and medicines, that's another policy that is also very important and where content matters. Process. Remember, do you? What Walt used called the stage model: identification of the problem, formulation of the policy, implementation of the policy, and evaluation of the policy. And last but not least, the actors. It could be individual actors, people like Nelson Mandela, or for that matter, Ronald Reagan. HIV/AIDS was not spoken of in the United States until Ronald Reagan. You remember the president. And before that, he was an actor. And one of his friends got HIV/AIDS and died, Rock Hudson. And then Ronald Reagan opened up and started. HIV/AIDS came on the agenda. It could also be very influential organizations like the World Bank or strong civil society movements. By now, I hope that you have some idea about what is policy analysis and the framework for that. So let's move on. Now, ideally, research and other evidence would influence policy. And policies are implemented in systems. The systems are to operationalize the policies. And then again, ideally, we have follow-up, evaluation, and feedback. So this process is not linear, but rather circular. Leads to system adaptation and adaptation of healthcare policies. This is in theory. In reality, it's ever so often happening that new policies are developed and implemented without evaluation of the previous ones. You, course participants, the new generation, you will change that. When I started with the concept evidence-based policy. It's actually a little bit old-fashioned. And I still wanted to keep it. Why? Because then I could make a point out of this. Very few policies are evidence-based because there are so many other factors. So the modern terminology would prefer using the concept evidence-informed policy. There are, and everything when it comes to models is about simplification. So there are 4 models. One is that researchers, they communicate to the users being decision makers, policy makers, etc. That's the push model. Then the other one, which is increasingly common, is that the users, decision makers and policy makers, tell the researchers, we want to know about this. That's the pull model. Then we have the third model, which is something in between, and a little bit more ideal model, which is integrating the efforts and by creating knowledge translation platforms. And it would be good for each and every one of you to think about your own context in the country where you come from. Which are the knowledge translation platforms? How are they designed? What type of members do they have? And how do they reach out to the community? Long time ago, very long time ago, I was a pediatrician. Now I'm a health systems researcher. As a pediatrician, I'm interested, obviously, also in children's health. So, where are the almost 20,000 children dying every day? Well, the darker the country, the more children that are dying. And it's obvious here, it's Sub-Saharan Africa, Afghanistan, South Asia. So which are the financial resources? And here you can see it's a completely reverse picture. This is health expenditure per capita. We don't need to go into details, but just to know that there are hundredfold differences between countries such as some of the sub-Saharan and my own country, Sweden. A very important policy the last decade or so has been the Health Millennium Development Goals, and I will use MDGs as a concept. 4 of them are related to health. Let's start with reduce child mortality. We don't need to go into details about how much. Do you think that the world is doing well on this one? We'll talk about it when we meet. Maybe you want me to tell. We're doing quite well. We are doing actually quite well. Let's go to the next. Improve maternal health. Here the situation is much, much worse. Small improvements in the countries where the mortality is 100-fold times higher than in most of the European countries. So here several countries are far from reaching the targets. MDG 6 is about combating HIV/AIDS, and this is being better and better controlled. Malaria, there are major improvements. What about developing global partnerships for development? One of them being with pharmaceutical companies. There are examples of where big pharma, the multinational companies, decided to give away some of what they have without charging the normal high price to resource poor settings. There are also other examples where big pharma is not doing what it used to do and what we need and must have in order to preserve global health and modern medicine, and that is antibiotics. There are no new antibiotics in the pipeline, and that risks threatening the whole of modern healthcare. We'll talk more about that soon. Now, in the forthcoming lecture, I will present some of the principles of a health system. We'll just touch upon it here. I said before that health systems is where policies are implemented. Okay, and here are some of the barriers to the Millennium Development Goals. Lack of demand for interventions at the individual and community level. It would be interesting to hear from you when we meet what you can give, what type of examples of that. Are there economic barriers here from the community? Is it about culture, lack of knowledge, or whatever? Drug policies are very important. And there is a large amount of medicines that are much too expensive for the effect they give. So existence of essential national drug policies is a very important part. And if it doesn't exist, this is a barrier to the MDG. Uncoordinated actors, that's quite self-evident. Underdeveloped service management capacity. In sub-Saharan Africa, public sector is often very weak. Inefficiency, problems with financing. We'll get back to that during the health system module. Weak health information systems. This is a fantastic opportunity. Huh? And there is a person that you can't see that at the moment is smiling very much because she represents Informatics. And that is something that has a capacity to change the global situation. In effect, already now, the explosion of access to mobile phones is a positive revolution also in countries in sub-Saharan Africa. Finally, human resources. Another person is smiling now, also in the room, because she has a special interest in human resources and how to use human resources. And in so many contexts in resource-poor settings, there are so few doctors, so one has to have very innovative and creative thinking in order to meet the needs. Now, this module is not about health systems, it's focusing on policy. This figure is something that I designed based on the WHO framework for health policies, but as you will see during the forthcoming lecture, that had forgotten the most important, namely the patients and people. And it wasn't put into a kind of module that clarifies the importance of the interface between the different building blocks. I also wanted to underline that health policies are implemented in different ways in the different building blocks, and that today, with globalization, mobility of services, deliveries, ideas, innovations, individuals and microbes, is absolutely essential for and affects any national health system. Okay? Just to take one example. Microbes. Antibiotic resistance, the faceless threat is growing. I mentioned it before, it's a threat to modern medicine. And microbes that are resistant to antibacterials, to antibiotics, don't need visa. So clearly, they are important for the national health systems. Our research group aims to contribute to global health via knowledge generation, working multidisciplinary. You can see both research and policy dialogue. You want to know more and you're modern? Well, this is one opportunity. You want to do it via the website? This is another opportunity. And you will also have an opportunity to do it face-to-face. Welcome, and thank you for today. You want to see one more, maybe? Yes. So these are some of us. This is, again, the website. Okay, thank you very much.